Hi, this is Dr. Van Dusen at New Hope Chiropractic. Today I'm going to talk a little bit about the connection between foot problems and knee problems. Due to bipedal locomotion, that's walking around on two legs, which we do, foot and ankle problems have the potential to affect everything above the feet, even your knees. So when analyzing the way we walk, also known as the gait, we find when the heel strike takes place, the heel and foot motion causes supination, or the rolling out of the ankle. That's when your heel strikes the ground. As the unloaded leg begins to swing forwards, there's a quick transition to pronation where the heel and ankle roll inwards and the medial longitudinal arch of the foot flattens and pronates normally. So during the transition from supination to pronation, the flattening of the medial longitudinal arch acts like a spring, and this propels us forwards, followed by the toe off, the last phase where we push off with our big toe, and then the cycle starts with the other leg. However, if you watch people walk from behind, you'll see many ankles rolling inwards way too much, and this is called hyperpronation, and it's not normal. So at what point does this normal pronation become hyperpronation? Well, the answer is not black and white, because there's no specific cutoff point, but rather a range of abnormal. So hence we use the terms mild, moderate, and severe hyperpronation to describe the variance or the degrees of abnormality. Hyperpronation can lead to the development of bunions and foot and ankle instability, and that can cause and contribute to knee, hip, pelvis, and even spinal problems. Even neck and head complaints can result. It's kind of like a domino effect. One study looked at the incidence of hyperpronation in 50 people who had an anterior cruciate ligament rupture, that's the ACL, versus 50 people without a history of knee or ACL injury. And they found the ACL injured subjects had greater pronation than the non-injured subjects, suggesting that the presence of hyperpronation increases the risk of ACL injury. So I, as a doctor of chiropractic, am trained to evaluate and treat knee conditions of all kinds. And often this includes prescribing exercises and utilizing foot orthotics in an effort to restore the normal biomechanics of the foot. And that, coupled with adjustments, can have positive effects not only on the knees, but also further up the body, all the way to the spine and up to the neck. So check us out at newhopechiropractic.com, and we're always available for a complimentary consultation to see if your foot problems may be causing problems with your knees and even further up the spine. So with that, I hope you have a healthy day.